So we're doing Nemaline Myopathy and the respiratory complications that come with it. What is Nemaline Myopathy? So Nemaline is meaning to have the form of threads, or it's fibrous. And myopathy is obviously muscle weakness. So the combination two is basically abnormal fibrous structures within the muscles that cause weaknesses throughout the body. It's usually a congenital hereditary neuromuscular disorder that causes muscle weakness. In children under 2 that have really severe cases, it actually has a really high 2 out of 3 of them die before the age of 2. It's very effective on the chest cavity, and it has a lot of difficulties with breathing. Yeah, it's, like I said, it's most severe in like your face, your neck, and your trunk, so pretty much just the main part of your body. Your arms and legs aren't affected as severely. And it's also known as broad body disease, because when you look at, we actually have a picture in a couple slides, but there's a picture of it at a cellular level. You can see it kind of looks like these little rods going through the muscle striations. They're just kind of these tic-tac looking things in there.
So there's 6 different types. There's severe congenital, the Amish inbreeding, intermediate congenital, typical congenital, and this is going to be most likely or most common feeding problem in your infants. And then you have childhood onset and adult onset, which is going to be your mildest form or your least form that you're going to see the most effects of you. The systems that can be affected through it obviously is going to cause skeletal and muscle tone issues, and then which would be, they're not able to move their bodies in the way they should. And this is going to directly affect the muscles that you use to walk, posture and eating, and of course your diaphragm for breathing.
So we've got the causes of the Nemaline myopathy. So it's typically an autosomal recessive gene, meaning that both parents carry a recessive trait that passes it down to their child. But it's actually not, that's the typical thing. It can randomly happen through random mutations, obviously, but I think that's actually useful. So we've got roughly 15% of the Nemaline myopathy cases are due to NB or Nemaline gene mutation, which is a protein in skeletal muscle. It's called, the skeletal structure is called the sarcomeres, and it's used for muscle contractions. And then the 25% of the cases are from an ACTA1 gene, which is actually a protein that aids in cell movements as well, but it's also in tensing of muscle fibers. Specifically, they also help to maintain the cytoskeleton to determine like the muscle shapes and cells and stuff.
Just for curiosity, that's my son, if you guys didn't notice, but my wife and I, we don't carry. It can be spontaneous mutation that happen. We both got tested and we are negative. So just so for curiosity, he created. And if we do have another kid, there is 1% chance happening. Just because it happened once, it can happen again. But if we both carry it, then the chances will be a lot higher.
So diaphragm muscle is between the ribs, and the abdominal muscles are all used for breathing. So the breathing muscles allow you to inhale oxygen and exhale carbon. And then, so with weakened muscles, a person's not able to take in as much air. And then coughing ability is reduced, so coughing is very important to clear the airway and prevent ammonia. The child's lungs may not grow and develop properly, and decreasing breath volumes can cause a buildup of carbon, so it could lead up to changes in the pH, which is acidosis, or acidosis. And then this is more likely to happen at night because we naturally breathe less.
So there's a few signs of poor respiration that we all should be looking for in any situation, especially for parents of young children with the condition. So fatigue, if they appear to be overly anxious about situations or in general, if they have a failure to thrive, which is the poor or weight loss and poor weight gain, frequent lung infections. Then when they're very little and firstborn and infants, a weak cry where they're not screaming at us. Generalized shortness of breath. And then irregular, forced, or rapid breathing where you can actually see, their stomach being sucked in and then forced out. A weak cough, so they're not able to produce that sputum and open those airways through a cough. Where they choke frequently just on their normal salival secretions. And then also coughing and choking during feedings is very common. And then overall, they have a poor appetite and poor growth.
So some of the devices that we will be using as respiratory therapists and that a lot of patients with Nemaline Myopathy, specifically Rich's son, use. So we've got a portable Trilogy ventilator to provide breathing support to the patient. This is a home pulse oxygenation meter to check the oxygen levels and your pulse, which can be good in determining a patient's vital signs rapidly. This is a portable suction unit. When in the hospital or healthcare settings, you'll have a wall suction. But at home or in transit with a respiratory complication, you'll need to have the ability to suction. This can be provided with a battery pack contained in the unit, so you don't even need a plug into a wall. This here is a CPAP machine, which can be used to provide breathing support at night, both with Nemaline Myopathy and sleep apnea. This is a cough assist device, which can change the pressure with a mask fitted to the patient's face to help produce secretions, to exude those secretions out of the body, be able to spit them out.
So what does that do?
The cough assist
Yes.
will provide force pressure in, and it will also pull pressure out to assist the patient in moving the secretions up out of the bronchi and the alveoli.
But
And there are
it is-
just two different models. This is an older model, and then this is by Philips Respironics, which is a new, more computerized. It doesn't have all the little dials on it. It's more like your iPad touchscreen.
But it's not a suction, it's air.
It does provide some suction by pulling
Well,
the secretions up,
It's a vacuum?
It's like they call
like a Hoover.
pulmonary plunger. So
Yeah.
you put pressure in and out.
Oh.
So you push, pull,
Oh.
and that moves it up the airway to where they're able to spit it out.
That's pretty much it.
And then
We
this is
actually
the
are gonna show
incentive
you.
spirometer
Okay. And
that
then,
is used post-operatively for all patients, but it allows you to test the lung volume function without like a pulmonary function test in the field. And this can also help you exercise your lungs post-operatively, make a quicker recovery.
nice. And you call it a respirometer.
The respiratory
Incentive
care
spirometer. Incentive.
Incentive?
called,
Spirometer.
you need to do daily trach care.
Spirometer.
That means you just need to clean it. I did, like, this is what we usually do in the morning. I usually do with a CDC pretty loud, so you might listen to the music there anyways. But, so we need to clean the trach around the stoma. So what we do with saline water and gauze, we clean it out. I do have on YouTube, but that's a little longer video about the trach care, but you guys can see it. We need to change the trach every 2 weeks, which is a little bit more stressful. And cough assist and suction as needed. Normally we can hear the secretions. So that's the cough assist that we do. You put a 35, for him in his case, it's put a 35 pressure in within 2 seconds and 35 pressure out in 2 seconds, and then there's a pause. Usually at that pause, the kids cough and he brings it up.
The setting, was that provided to you by doctor order?
Yes, the doctor gave it to us. I changed it once and I got in trouble, but that's why I'm here, so I can have the license and not get in trouble. So that's his Trilogy. He has one for that's stationary, which is that one, and one that we go around. And that's like the humidification for him, and that's the second. And the post socks right there. It's a little bit different than the picture that we had.
Because you have a hospital grade at home, correct? Not the portable.
Yes, yeah. Well, that's a portable, but it's it's pretty much similar with the machines that we have in there. So that's the cough assist. Like I said, we usually do 5 sets of 2. So put in and out suction. We put the suction into the trach. Then he does it again.
And is he at a mild
After
angle?
we do two, we do the umbu bag, kind of give him a break because it's pretty intense. If you, like, I have a video that I didn't post yet, but it's me testing the cough assist. And it's like, it's a lot of pressure, but when you do with the trach, it's a lot easier than doing without the trach. Until he was 8 months old, we did without the trach, and it was a nightmare. Okay.
So there's some more devices. This typically will not only affect the respiratory muscles, but all of your skeletal muscles as well. So mobility will be compromised. To move a larger patient, larger than a child, you would want to move safely for yourself and the patient. So you would use a Hoyer lift with a sling. You could also use a slide board with a wheelchair to transfer to the bed or back, as opposed to manually lifting the patient. And then as the patient grows, independence is very important. So they may be using some power wheelchairs and other assistive devices.
So, say you.
Oh yeah, this is thank you. So there are no treatments to cure Nemaline myopathy. However, kind of proactively preventing a decline can be very assistive to the patient in continuing their independence. So stretching, respiratory therapies, and medications can be used to treat the symptoms, but there is absolutely no cure at this point for Nemaline myopathy.
There are some genes replacement therapies coming along, but still kind of far. I did a video of his therapies, but basically, you always wanted to do occupational physical therapy, and our goal is you get the muscles of the breathing stronger, because that's what he gonna need most. Everything else we kind of can adjust with wheelchair and technology and all that stuff. So breathing is the main issue, especially to keep him healthy. So those are a little bit of the scenes. If you saw in the other picture that we do have, I couldn't record the pool because I was in Speedos and my wife was in bikini, so we didn't want to put it in there. But the water therapy is very good. It's a little difficult with the trach, but it's good because you eliminate gravity, so he's able to move freely. And one thing we noticed is when we did that with my son, he was able to realize and get that awareness, like, okay, my body can do that. And he would transfer the movement he did in the water to outside. It was pretty good.
Oh, neat. Yeah.
And then I made a video this weekend with one of his friends from Denver that does have Nemaline myopathy as well. And I asked their parents how it is to live with Nemaline myopathy. And as you're going to see, it's the volume on. It's all about respiratory pretty much. So.
And what's your muscle disease? Same, Nemaline myopathy. So we're the Englishes. My name is Stephanie, and this is Trach Care. And Jackson is 5, and we've known about his muscle space since he was a couple months old. Okay, hold on a second. So,
when Jackson was little, our main concern, we have new concerns now, as you can see. His main concern was respiratory health. He had no cough, he had no way of getting things out of his lungs. He aspirated those days, and when he had an infection, we had pneumonia or RSV, which he did. It was perfect, and we were in the hospital immediately, and we were there for weeks every time he got sick. So maintaining respiratory health was critically important, both in just making sure that all of us. We had an exposed to anything, and they have to come over to our house, and take them any place, especially during the flu season, and then just making sure that we doing everything we could, cough assist and suction, and everything to maintain his respiratory health.
And now it's a lot better as he gets bigger, his lungs get bigger, and he can cough now. He can tell us when he wants to be suctioned, or when he needs to be suctioned, or when he needs cough assist. So the older he gets, the easier it gets, but it's still stressful to go through cold and flu season. We're always just waiting for that shoe to drop, and it's a little nerve-wracking, but he gets better every year. And so our life gets a little bit easier, but respiratory stuff just is always so stressful. We can't help anybody else being sick around him. It's always a little bit. Yeah, you can't help it.
It's not just the respiratory, it's not just pertussis and RSV and pneumonia, but you know, in the flu we get respiratory symptoms. Even this year had respiratory symptoms and was coughing for 2 weeks. So you know, whenever he's got a weakened system, you know, those respiratory things just go right to the surface, and yeah, we have to know when we have to pull the trigger and take him to the hospital, and fortunately this last time we didn't, but this is always right there.
And with him being in school, we want him in school because we have the benefit of him being like a great social environment, but it comes with a lot of germs, and other kids bounce back so much quicker. Like somebody else might have strep for a couple of days and then they're back at school, and Jackson's out of school for 2 weeks. So it's a little rough, but we figure it out.
But then he turned into a 5-year-old boy, and we have all the problems associated with that as well. But as he's getting bigger, and his lungs get bigger and stronger, and his chest muscles get stronger, and his diaphragm gets stronger, and those are all muscles, and we get less problems in the hospital stays.
So we figure out the rest, like all the other stuff, all his road can be adapted. So he's got his power chair and stuff to get him around, and we can adapt the rest of the world.
And so when he was a little kid, did he use the mask only to?
He's always had non-invasive, yeah, and so he was on his mask.
So yeah, the difference, he's on the mask only at night. Okay, but he used it more, but as he grew, he was able to just use the mask. He have a full mask to sleep at night.
Probably 4, he had a couple hours in the afternoon and then all overnight, and now that he's in school full time, all during the day, he only is on his mask at night or when he's sick. So he knows when he's sick, he's on his mask often. It's like our first line of defense.
Here's being there since we come from his mask at night, but it's something that's safety net for us. Make sure that as long as that machine's going, then he's breathing. It allows us to sleep as well.
Thank you. Very good.
Is your son affected by any allergies or,
No, not yet.
yeah, but it's possible, but no?
No, not so far. It's good to go.
Yeah.